Welcome to the Buy Blacks channel. I am Camille Dundas, co-founder and editor-in-chief. Joining me today is Mayor of Toronto, John Tory. We're talking about COVID-19 and the impacts on the Black community in the city. Mr. Tory, thanks for being here today.
Thank you, Camille.
When you think about the Black population in Toronto and how they're being impacted by this pandemic, what are you most worried about?
Well, two things, I suppose. First of all, we're trying now, and the city of Toronto has said, regardless of what others do, that we're going to collect race-based data because, of course, one of the main concern you have that is way more important, frankly, than business is are the Black community in Toronto being disproportionately affected by the virus itself? And I think, oftentimes the virus and people getting it has to do with their living circumstances. If they're living in a congregate circumstance or large numbers of people in one home and this kind of thing, or if they are in, lower income circumstances where their housing, for example, is going to be different, or even other aspects of their life. And so I think it's very important for us to sort of have a look at that and understand that better than we do. And certainly in Toronto's case, we've said we're going to collect the data as best we can and be able to analyze that. The
Yeah.
second thing, obviously, that I worry about is the economic impact. And for some of the same reasons, we have people that are disproportionately in jobs that are lower income, but I think we also have, situations where a lot of people are entrepreneurs in the Black community, for example, and entrepreneurs have had it tougher because they don't have a big company to stand behind. And I'm not saying that in any critical way of big companies. I'm just saying big companies have big bank accounts or borrowing abilities can see their way through problems like this where the business dries up for a while. They have some staying power, and
Mhm.
so I'm worried about that too. And I hope some of the measures that have been undertaken by the other governments are helping with that. And I've been aware of the representations being made by the Black Chamber of Commerce that we should try to do more, and those are the kinds of things we're talking with the other governments about all the time.
hmm data is one thing, and we'll touch on that in a minute. But, what I'm really worried about is I feel like there's this glaring disconnect between the public messaging of like stay home, protect yourself, and the private reality for so many people in Toronto who actually aren't allowed to take care of themselves by staying home. Talking about low income, mainly racialized workers, as you mentioned, still being forced to get up and, drive TTC buses or get on those buses crowded at 7 a.m. to go to jobs at grocery stores, factories, and warehouses so that privileged folks like you and I can have access to our essentials. How are these workers being supported or even protected from the risks they're taking every day?
Well, I think you make a fair point, but on the other hand,
Mhm.
a lot of those jobs have been designated for better or for worse as
Mhm.
essential for the rest of us. But I
Yep.
think we've seen some good things, and some of it's been done, frankly, by the private sector at
Mhm.
their own initiative, which is a better way to have it happen. So, for example, you've seen some of the grocery stores, where you, as you point out, some of the people from racialized communities work, unilaterally on their own say, you know what, we're going to increase those wages because they probably should have done it before, but the
Mhm.
bottom line is they're doing it now because of the extra risk and extra stress they're under.
Mhm.
Other programs have been government programs which have recognized the fact. Just yesterday, Premier Ford, with I think money that came from the federal government as well, announced I think a $4 an hour
Yeah.
wage supplement for people who are in some of those very same jobs we're talking about. So
Mm.
I think people have tried to have a recognition of that fact. I think there are some things we're going to have learned about. And some people will say we've been talking about it for years and nobody listened, and that may be true. But the bottom line is we are where we are now. I think when it comes to things like long-term care,
Mhm.
and staffing levels and all that kind of thing, that is going to be a big part of an overall examination that we're going to have about that and about who the people are that work there and what their background is and what their wages are and so on. We've tried as a city, for example, we have 10 long-term care homes, and we've had our problems in some of those, but those problems have not arisen, I don't believe, because we had a lack of staff to begin with. We hire more and pay more. We're able to do that because we're a government. We're not trying to make a profit. And again, I'm not against people making a profit, but it's just that when it comes to this long-term care, we've got a lot of questions that we're going to have to ask each other and a lot of examination we're going to have to do. So I take your point, and I
Mhm.
think these are things that we can look at in part now, but I think a lot of it's going to be stuff we look at after this is subsiding to some extent.
Now, you mentioned the province. On appearances, it seems like the province is doing all it can to respond to this pandemic. But, I can't help but see the irony in the fact that this time last year, the province announced it was cutting $1 billion from Toronto Public Health over the next 10 years. And these cuts would affect many areas, including immunization, monitoring, infectious disease control. And at the time, the city of Toronto was literally begging the province to maintain its current funding. Is that something you're thinking about right now?
I'm not sure we were begging as much as demanding, but well, you know what? It's true. I mean, I guess if begging had been what was necessary, but I was demanding it at the time on the
Absolutely.
basis of common sense. And, I didn't know a pandemic was coming. Who did? But I just knew that a lot of the work they did, and it's not limited to disease management and control, but it's also things like student nutrition and some of the things that are for the benefit of some of the very same communities we're talking about, people who are marginalized, whose kids need to have healthy meals, and a lot of the new baby checks that are done and so on.
Hmm.
I think now when you look at it, you'd say, well, okay, it's fine to sit and say, well, we told you so.
Hmm.
I don't bother with that.
Okay.
I only assume now, and I should assume nothing, I guess, but I assume now, I think the government of Ontario has changed its understanding of public health.
Hmm.
Who couldn't have? Even I have become to understand the role of public health much more than I did before, but I understood it pretty well before. So I think that's not going to be as big an issue. If anything, they'll be looking for ways to increase the budget for public health because it's going to be standing between us and
Hmm.
some future wave of this or some future pandemic. And I think we're going to know from this experience that all of us, without being critical, all of us have to be better prepared in terms of personal protective equipment and inventories of that. And you could go down a long list.
Hmm.
But so I'm just glad, what I'm glad of? I'm glad last year they reversed those cuts
Hmm.
and they said they would leave them the money in place for one more year. Well, I think even that we don't need to worry much about that. We should just ask them now, are you going to keep it in place for forever?
Yeah.
And I think they will say yes.
Yeah, you mentioned Black businesses and also members of the Black community being more likely to be entrepreneurs and whatnot. Black businesses in the city were already in a precarious position and now closing at a much faster rate. I'm wondering who in the Black community, in the Black business community, you're planning to work with to help these businesses recover post-pandemic.
Well, the good news is that the BBPA has always been there, and now we have the Black, Chamber of Commerce,
Hmm.
and I think that the fact that there are, at least two, if not more, of these, very responsible, constructive, kind of well-supported organizations will help us. And I think that, look, you have to be clear, as I have tried to be, and even sort of having an anti-Black racism strategy,
Hmm.
that carried with it the initial acknowledgement that there was anti-Black racism. And I'm not saying the reasons that Black businesses are struggling is because of racism. That may be true, I hope, a tiny percentage of the time. What's really the case is that a lot of people from marginalized communities, including but not limited to Black Canadians, have trouble getting into the mainstream, which is the real problem I think ultimately we have to solve. So that, these organizations like Blacks in Tech and so on, I think it's called, what is it, BUPA, or anyway, you know what I'm talking
BPN,
about.
yeah.
These are organizations that are going to accomplish, I think, what we really have to do, which is to make sure that Black Torontonians have every bit as much access to the tech jobs and to being,
Hmm.
whatever they want to be, which I think historically, for a bunch of reasons that go all the way back sometimes to their housing circumstances, their school circumstances, they dropped out of school, they didn't get the support from programs we might offer to keep them in school and all this. So they end up as entrepreneurs because that's the only way to find their way into the business community. And many have made incredible successes of themselves as a result of those circumstances.
Hmm.
However, it also means many more are in a precarious circumstance. And I think one of the things that I've certainly talked to people like Mike Cole about
Hmm.
is the fact that we're going to have to take a look coming out of this at ways in which we take entire strips of stores like along Eglinton West, where it
Hmm.
should be the verge of a boom after all these years of misery, where there's a new transit subway coming in. This should be a time when they're saying, holy mackerel, it's never going to be better
Hmm.
than now, because we're going to have people able to come and patronize our shops and get some of that great food and
Hmm.
some of the entertainment on a subway.
Hmm.
But yet, what you find is the opposite, which is they're just holding on by their fingernails, as you say. So I think we're going to have to find ways to deal with that, and to make sure that we sort of give some degree of support to those businesses because of their precarious circumstances.
Hmm. Two more things I want to ask you about, both related to data. As you mentioned earlier, Toronto Public Health recently announcing it will start collecting COVID-19 data on race to try to better understand the health inequities. And it sounds really encouraging, but as we also know, Ontario ministry legislation does not support this position. Their exact statement was, existing legislation does not require or authorize health information custodians to collect race-based data. Wondering why the city chose to break from the province's and the federal government's position, for that matter. Why haven't we been collecting race-based data all along?
Well, the reason we broke from the province is for the same reason we became the first city in Canada to collect race-based data when it comes to policing. And
Mm-hmm.
that is because I think what people now recognize, and people have been critical of me in the Black community, and I accept that. I mean, it's one of those things where you take the criticism of these jobs as it comes. But I hope they will also take note that I was the mayor on the police board when, for the first time in the history of the country, I believe, we agreed to collect responsibly and properly and use responsibly and properly race-based data to determine if there were issues that we could identify from that data or help us to identify policing issues. And the same is true with the public health data in the case of COVID-19.
Mm-hmm.
If we can learn something about, how this virus has disproportionately impacted upon people who are with brown and black skin and other things like that, and also extrapolate that out to geography and a whole bunch of other things,
Mm-hmm.
then this is going to help those people to stay healthy. It's going to save lives in that community and other communities. And so to me, responsibly done, sensitively done, responsibly used, these are things that we were skittish about doing before.
Mm-hmm.
I'm not, because I think that if it's responsibly and sensitively done, it is going to help us to save lives and to make sure that communities that have been hardest hit by issues like this, COVID-19, are going to be better off when the next one comes or when this one comes in a second wave.
Yeah, the use is the really important part. And I think what community members are most concerned about. There's a level of distrust, I would say, that exists between public health and the Black community, given the historical context of how data has been used against the Black community in the past, like Africville, for example, where public health used the data of disproportionate health outcomes for destroying Africville, right? So there's a level of distrust there. How do you think the data would or should be used after it's collected?
Well, first of all, and by the way, we did this when we announced we were going to collect race-based data with the police. And again, the issue there was that back 10 years ago, when somebody talked about doing this, they talked about it in a way that was incredibly insensitive and that would have reason for people to be afraid of that data being collected as opposed to seeing it as a benefit to identify problems and find solutions. And so this time, when we did it last year in 2019, we announced safeguards right off the bat, right from the top, and said, look, this is going to be used only in a certain way. It's going to be safeguarded by some people who will look over the data and how it's used and who uses it and so on and so forth. And the same will be true, I know, of the health data. Health data is already subject to massive numbers of protections. In this case, all we're doing is looking at collecting one more piece of information, or maybe one or two, that help identify people's backgrounds so that we can then use it responsibly to help them be healthier. And so I just think it's all about the safeguards. And I hope it will allow us to kind of look at the patterns and match it against geography and match it against income and against occupation and against family size and against 1,000 other things. But we will also know that those people are part of a community, based on their race. And I think that will help us to serve those communities better and protect them better on the health side, as it will help us to police them in a more sensitive manner, if I can call it that, depending on what the police data says when we collect it, and properly and responsibly examined and safeguarded.
So you mentioned police data, and recently the province made the unprecedented step to give police services access to a database with the list of names, addresses, dates of birth of people who have tested positive for COVID-19. Would you support the Toronto Police accessing this database?
I don't know in what circumstance they would want to access it. I mean, maybe if there was some instance where they had to go out and enforce quarantine on somebody who'd come out from out of the country or something. But I'm very cautious about those things. I never say no until I sort of say, well, all right, what are they going to use it for? And what we did, for example, with all the data that people, look, I should say, by the way, I put my hand up a long time ago to say all the data from carding should be destroyed.
Okay.
I literally said I would go over to police headquarters and start a fire in the basement to burn it all. Well, I did.
Okay.
Because I feel it should be destroyed. But there were various legal reasons we were given as to why it couldn't be. So what we did instead was we set up an absolutely sort of fireproof method whereby people have to give permission. There has to be a record taken of who's asking and why are they asking. And as it turns out, when you actually look at that with a proper process in place, almost everybody that's asking for the data is somebody asking for their own data. Not like the police asked 4 times in a quarter, and they had to say why. So I would like to hope that with this other kind of data you're referring to of the people who test positive, I would think that should be very, very, very sparingly shared with anybody, because it's health information. I mean, we're very strict about saying, well, if you have a sexually transmitted disease, for example, you have to register it. You have to tell people you have it, which I'm sure is hard for a lot of people to do, but they have to do it so that they can, just deal with how many cases we're having and all this kind of thing. But they sure wouldn't be very happy if they thought it was being shared. And this is just as sensitive. It's not a sexually transmitted disease, but it's a disease, and not everybody wants other people to know they're sick. Yeah. So I would think that whatever the police need to do with that, they should have to justify to somebody. Here's why we need it. And if that's the case and they can justify it to somebody, I think always ideally it's a judge, only because judges are used to making really tough decisions and looking at things very objectively. But so I don't know enough to know why the police want it or what
Yeah.
they would do with it. And on that basis, I would be kind of hesitant, just because I'd say, well, look, we have to satisfy that there's a good reason, and then satisfy there's a proper process in place to protect the people who in fact own this data. My view as to who owns that data about their own health, the people whose health it's about. That's
Yeah.
where government
And
keeps it, because they have records of, who used the healthcare system or whatever, but you own the data because it's about you.
And in all fairness, I should mention that the Toronto police have said they don't intend to access the database for now. That could change. I think the concern from the community is that it's a human rights issue, in the sense that if you think about people who are, let's say, people who do have COVID-19 and who are outside when they shouldn't be outside. Those aren't people who generally are just randomly wanting to be outside. They're people who don't have a choice because they have to travel on the TTC, they have to go to work, or they just have to be outside of their homes to make income. And so those people are most likely to be from racialized communities. And so there's a fear that this is tantamount to public health carding, right?
Yeah.
So, yeah.
And, as you know, there have been some other measures brought in just on an emergency basis. And I'm not sure whether the police having access under the law is an emergency thing. In other words, it'll end when the emergency ends. And I was prepared to, just swallow hard, given everything I've been through with carding, and say, well, okay, if they need to have information about people, or no, I think it was that they could ask people for the identification, which under the abolition of carding, they could not. Just people walking down the street couldn't be stopped randomly and asked for their ID. That was the whole idea of getting rid of it. And I was prepared to sort of accept the fact, well, maybe that's something for the emergency that we have to do, not in the context of treating people as criminals, but from the standpoint of ensuring that, people who are supposed to be quarantining themselves are doing so. But I understand what you're saying, which is a lot of the people that are outside, even when, frankly, and I would have said to anybody, no matter what, if their income was such that they sort of felt they had to go to work, but they had a positive test result, I would have said, well, look, it's us letting them down, not having some provision where either their employer or the government would say, look, we're not just going to order you to stay home. We are going to order you to stay home and supply you with the same Canada emergency benefit that is being given to people who lost their jobs. Because, the last thing we need is, frankly, for someone feeling they've got to go to work with the virus. I mean, that's a disaster, because
it's happening,
they don't tell anybody they have it, obviously. It's bad for them because they should be home recovering. And of course, it's really bad for the people they work with who don't know that there's this person in their midst who just feels they have to be there because they need a paycheck. Yeah. With all the money we're spending, 175 billion, I think it is, on giving people the 2,000 a month, and it's money well spent, by the way. I think it'll tide people over until hopefully we can open the city up again. Whatever it would cost to add those other people in and say you don't have to go to work either. Now, we do need people to do the jobs you talked about earlier. We can't have everybody staying home, but certainly the people who test positive, absolutely, positively, without exception, they should be given some allowance that will allow them, either from their employer or from the government, that will allow them to stay home and recover from their illness. When you're sick, you're supposed to stay home no matter what it is, COVID-19 or anything else.
Absolutely. And lastly, Mr. Mayor, it's been over a month now that we all been on lockdown. All everyone's thinking about is
when is the date?
Right. I'm not going to ask you a date because I know there's no date, but in your mind, what is the reopening of Toronto look like for you?
I think that's a really good question, because I think, first of all, it looks like something that's still a bit away, because I think we really have to see some changes in the patterns. And, they reported today the number of cases in Ontario is the lowest in a week. Well, we've got to see that repeated, for quite a few days in a row, where it's the lowest in a week and the lowest and lowest and lowest, and it gets lower and lower. We've got to see the rate of hospitalization continue to decline and so on. Then I think what you're going to see is a very gradual reopening. And that's for two reasons. First, this is uncharted territory. We've never had the reopening of the economy completely shut down before. And so I think, especially when you layer on that a health problem that we don't know very much about. I sit with our medical officer of health, and she's an incredibly smart woman. But when you say to her, well, if you've had this, do you have immunity? If you've had this, can you get it back and spread it to somebody else? If you're asymptomatic and you're going to work, are you spreading it to other people? And there's a million questions that we have to layer on top of how you reopen. So that, as I said in an interview I gave previously today, you can be darn sure of one thing: you won't be going to a Blue Jays game in a stadium full of 40,000 people anytime very soon. Yeah. Like really soon. But you might be able to go to a restaurant sometime, reasonably soon, and sit at a restaurant where every third table is occupied, but the other two are not, so that people are spaced far enough apart. And you might see people in the restaurant wearing a mask, maybe the customers or the servers. Yeah. And so there's going to be a lot of things that we're going to see and experience that will be part of a gradual reopening of the city. And a change in our life, sometimes permanently, because at least permanently meaning for the foreseeable future. So I guess all I can say is I don't know the date. I wish I did. And I wish I could say it was tomorrow morning. It will not be all of a sudden like that where you flip a switch and everything's open again. We will do it carefully because we can't afford to mess it up. We can't afford to mess it up and have a second wave. So by next September, you and I are sitting here, Camille, having a chat, and you're asking me, how could it be that we're all closed down again? We just can't do that. I mean, and that's why these decisions are so big and why we're being so careful about it.
Absolutely. Mr. Mayor, thank you so much for joining us today.
Thank you very much for having me on. I appreciate it. And please, people out there, stay safe, stay away from each other, stay home for now, and have hope, because we're working hard on plans so that the minute we get to that promised day, we'll be able to implement those plans and people will be able to start getting back to the things they love to do, including work. You don't realize you actually like your work in many cases until you don't go there anymore. So thank you very much for your patience to everybody and for all your contribution to the fact things are getting better, because people are staying home. It is getting better. We just have to have some more patience. That's all. Thank you.
Thank you.